Aclop detailed information and precautions for use. Aclop is a medication containing the active ingredient Clopidogrel, belonging to the class of antiplatelet drugs. It is used to prevent blood clots from forming in the arteries, helping to reduce the risk of stroke, heart attack, and other vascular problems. One mechanism of action: Clopidogrel inhibits platelet aggregation by blocking the binding of ADP adenosine diphosphate to the P2Y12 receptor on the platelet surface. This reduces the ability of platelets to activate and form clots. 2. Pharmacokinetics: Clopidogrel is rapidly absorbed after oral administration. The drug is extensively metabolized by the Cytochrome P450 enzyme system CYP, primarily CYP2C19. Peak plasma concentrations are reached within 12 hours. The elimination half-life of Clopidogrel is approximately 8 hours. 3.1 Interactions with drugs metabolized by the Cytochrome P450 system. Clopidogrel inhibits CYP2C9 at high concentrations in vitro. The drug may affect the metabolism of the following medications: phenytoin anticonvulsant drug, tamoxifen breast cancer treatment drug, tolbutamide anti-diabetic drug, warfarin anticoagulant drug, torsemide diuretic drug. 3.1 Interactions with drugs metabolized by the Cytochrome P450 system. Fluvastatin lipid-lowering drug. Many other nonsteroidal anti-inflammatory drugs. NSAIDs. 3.2 Interactions with CYP2C19 inhibitors. Concurrent use of Clopidogrel with CYP2C19 inhibitors such as omeprazole, esomeprazole, lansoprazole, fluvoxamine, fluconazole may decrease the concentration of the active metabolite of Clopidogrel, leading to reduced treatment efficacy. 3.2 Interactions with CYP2C19 inhibitors. Caution should be exercised when using Clopidogrel concurrently with CYP2C19 inhibitors. 4. Contraindications: individuals with known hypersensitivity or allergy to any component of the drug. Patients with bleeding disorders such as gastrointestinal ulcers or intracranial hemorrhage. Pregnant and breastfeeding women. 5. Precautions for use. Dosage: the dosage of the medication is prescribed by a physician based on the patient's condition and characteristics. Administration: take the medication with water, do not chew or crush the tablets. Duration of treatment: the treatment duration depends on the condition and the physician's decision. 5. Precautions for use. Caution: inform your doctor about any medications you are currently using, including over-the-counter drugs. Carefully monitor for signs of unusual bleeding, such as nosebleeds, gum bleeding, easy bruising, blood in the stool or urine. Report any side effects you experience to your doctor. 5. Precautions for use: inform your doctor about any medications you are currently using, including over-the-counter drugs. Carefully monitor for signs of unusual bleeding, such as nosebleeds, gum bleeding, easy bruising, blood in the stool or urine. Report any side effects you experience to your doctor. 5. Precautions for use: inform your doctor about any medications you are currently using, including over-the-counter drugs. Carefully monitor for signs of unusual bleeding, such as nosebleeds, gum bleeding, easy bruising, blood in the stool or urine. Report any side effects you experience to your doctor. Common side effects: bleeding, easy bruising, headache, diarrhea, nausea, fatigue, itching. Common side effects: rash. Serious side effects: intracranial hemorrhage, liver dysfunction, severe allergic reaction. 7. Storage: store the medication at room temperature, away from direct light. Keep out of reach of children. 8. Consult a physician before using Aclop. Note: this information is for reference purposes only. Do not self-medicate without the guidance of a doctor.